Polycystic ovary syndrome is a disorder that affects hundreds of thousands of women, and it can lead to a lot of problems if left untreated. Here to tell us more about it is Dr. Joshua Berger. He's a reproductive endocrinologist and medical director with CHA Fertility Center in Hollywood. Welcome. Thank you so much for being here, doctor.
Thank you so much for having me.
This is a really important issue, and I know a lot of women, they're so used to caring for other people first that a lot of times they're not taking care of themselves. But this is a huge issue that women need to know about. What is it exactly for folks who don't know?
So it's the most common endocrine problem that women of reproductive age have. So you're not going to have a 5-year-old with polycystic ovary syndrome, and you're not going to have a 70-year-old. So these are women who, once they start their monthly flows until the time that they sort of stop, you're going to find that this is happening. The most common time frame is in the 20s to 30s. As you start getting older and have less eggs around, it starts to dissipate a little bit, some aspects. There are 3 main things that you're looking for. You're looking for menstrual irregularities. And not just 1 month I bleed a little bit heavier than the next month. You're looking for skipped periods, lots of them. Maybe 1 period every 3, 4, 5 months. You're looking for, when you have those periods, really, really heavy flows. You're also looking for signs, either clinical or laboratory values, of too much testosterone in your system. And that can be manifested by back acne, really bad acne. Women who've shaved, you shave your face or your chin. It's not just plucking one hair. This is something that's more. I have no hair, but this is for women who have male pattern hair loss. So it's not normal to start losing your hair like a man. That's a sign of too much testosterone or too much hair. Are you getting hair lower down in your privates that looks more like a male pattern of distribution? Is it going out way outside the bikini line onto your thighs, and is it going up to your belly button? Are you having more maybe even in between your chest? So these are some things that
and
you're
so
looking
if you're
for.
a woman, you know, in your 20s or 30s, and you're going in for your annual women's wellness exam, is this something that your doctor will ask you about, or something concern you should be bringing up to them?
It is something you should actually talk to your physician about. So every exam with a physician should start off with a talk. It should not just be going in there and doing these tests and doing this.
The exam, right.
It's the actual history part that's the most important thing with the relationship with the patient and the physician. You need to come in and say, I have these concerns. And the physician needs to have their wherewithal about them and to say, let me listen to what you're actually saying and let me see what's going on. Many women come into a new physician's office and they've been placed on birth control pills since their early teens. And this was to help when you're first starting off with your periods. They're very irregular. And so you wouldn't even know that you have this syndrome if you've been on birth control pills for 10 years or 5 years.
And real quickly, doctor, what are some treatment options for patients?
The easiest thing is to just put people on birth control pills, actually. Polycystic ovary syndrome is the end result of many different types of disorders. Some of them are life-threatening and some of them are not. But they all sort of end up in the same way, and the cure is the same for the majority of them. Get a monthly flow so that the lining of the uterus doesn't get too thick. When you go on birth control pills, it also helps to decrease the testosterone that's floating around in your system, and that's because of other things that it does. It sort of increases some proteins in your bloodstream that act as sponges. It will help with the acne. It will help to diminish the amount of hair growth that you have. And then there are other more advanced treatments if you're having very, very severe symptoms. But some women show up, they have a little bit of dark lines around their neck, which could be signs of insulin resistance. The medical term for that is acanthosis nigricans. But there are lots of other things that you will talk about with your physician. The easiest things, though, first would be birth control pills, and not as an anti or not as a contraceptive, but you're using this as a treatment for a medical ailment.
All right.
Yeah.
Thank you so much, doctor. We appreciate your advice and your insight. Really important information to get out there. Thank you for joining us this morning.
Thank you so much.
And to learn more about the CHA Fertility Center in Hollywood, just go to our website, kcal9.com, and make sure to click on Seen on TV. We'll be right back.